You are listening to Love Your Practice with Dr. Laura Mock. I'm a general dentist, a practice owner, and a certified life coach. I teach women who own dental practices to lead with intention and literally fall in love with their businesses. Keep listening and you will see how learning to love your practice turns into loving your life too. Hello, ladies. Welcome back to another episode of Love Your Practice with Dr. Laura Mock. I am so happy you're here with me today, and stick with me because we are going to be talking to the amazing and lovely Dr. Bethany Piziks, who is a repeat guest for me. And today we're going to be talking about a new technology. Well, it's not that new. It's new to me, and it's new to a lot of dentists. It's a technology that we can use to help our patients and ourselves relax. So we're talking about a product called NuCalm and how it can help your patients have an easier time, which means that you can have an easier time when you work on them. And it's something that you can use for yourself for meditative and restorative purposes when you're not being a dentist. So stick around for this interview. There's information at the end on how to learn more. And I just started using this technology myself in the last few months, and it has changed, especially how I work on my more challenging patients. Give it a listen. See you on the other side. I would like to welcome to the podcast, Dr. Bethany Piziks. Bethany, thank you so much for joining us today.
Thank you for having me. I'm super honored and excited about this.
Well, I'm excited to have you because I have to say, let me add, you've been on my podcast before. We talked about your horse coaching. How do you say it? Gestalt?
Equine Gestalt coaching.
Equine
Gestalt, yeah. German word. So.
Yeah. But you have influenced me in my practice in a way that has made a difference for me. And that's why I invited you to come back a second time.
Quite a privilege to be invited back twice.
I know. But it's a rare opportunity because this is only my 51st episode. So, and some of them are soliloquy, some I just do by myself. So this means something special.
Thank you.
But let's just in case the listeners didn't listen last time, hear your last episode. Tell us a little bit about you, who you are and how you came to where you are now.
Yes, absolutely. I, at age 13, had what I call a lightning strike moment. I didn't really get struck by lightning, but it's one of those moments in life that changes the path that we are on, and we all have them. So I came home from school one day. I had two beloved horses waiting for me in the barn. Me and my brother ran all the way to the barn and got there, and the gate was wide open and there's no horses. And we looked everywhere. These horses were my beloveds. And if there's any animal lovers, you totally get that. They were my safe space. So it turns out that my parents had sold my horses while I was at school because we couldn't afford them. And they thought it would be easier. I didn't know. So because of that moment, I decided that I would never again lose something I loved for money, for lack of money. And so I decided not long after that I was going to be a dentist.
Oh, okay. So it's like a means to an end.
Totally. Like I thought dentists, do a few easy fillings, quick exam, make a ton of money, work nice hours, go home, play with your horse. And at 13, that's what I think that's what a lot of people think dentistry is.
Oh, I'll be a mom. I can choose my hours. Like there was no part in there where I was like, but what hours am I actually going to work? And what do the patients expect me to be there for?
Totally. And owning your own practice. And so anyway, obviously I went through dental school and I kind of forgot that was the reason actually as time went by, but I did think it would be a lot easier than it was. And I built this big building and started my practice from scratch. I had two charts in the drawer and one of them was my mother. And, so I had I moved into this building and I realized that all of a sudden there's a lot more responsibility than I was expecting, this huge debt load. And I went into a spiral of overwhelm, depression, darkness, fear, anxiety. And it was not an easy time. I started drinking a lot. I, bought things thinking that would help. And finally, I hired a coach, which changed my life. So, and this was in 2001 when coaching was baby, brand new. And I worked with this coach for a long, long time. It was one of the best decisions I ever made in my life, for sure. But the best coach during that time was actually my horse that was in my barn. Her name was Gypsy. And anytime I had a really bad day, I didn't realize it in the moment that she was actually a huge cathartic piece of my healing. I would hang out with her. So anyway, over time, what I decided was I wasn't passionate anymore about restoring teeth. I wanted to restore hearts and spirits of dentists and their teams. And this profession is so challenging, like in ways that I never would have imagined. And if you're not in the dental industry, you don't even have a clue. And I know your audience is, so you do,
Yeah.
you all do.
Yeah.
So long story short, I sold my practice and I became certified in, actually a 2-year master certification program called Equine Gestalt Coaching Method. And I combine Gestalt methodology, which is very effective, a therapeutic methodology, and the presence of horses and their healing powers their healing presence to help dentists and their teams have less stress, more joy, perceive the world differently through a different lens. And part of that journey, this all started in 2014. And I went to an ADPA convention in Tucson, Arizona, which is the American Association of Dental Practice Administration or something like that. I can't remember. They've changed the name. But anyway, I met Jim and Dave Poole, who are the heads of a company that makes a product called NuCalm. And NuCalm is like having portable on-demand meditative state at your fingertips. And we're going to talk a lot more about NuCalm today, but what I did was figured out how well NuCalm like folds in with my desire to help make dentistry easier, make life easier for dentists and their teams. So that's the short story. It was a lot.
So you've got your horses, and then you're now the head of the dental branch of the company that sells NuCalm, right?
I am. I'm the clinical dental. I'm the liaison for the company to all clinical use of this amazing product that changes lives and physiologically takes us into a relaxed state without drugs or side effects. So,
and I just want to add before we continue on that I recently folded NuCalm into my own practice, and I use it on myself.
I'm glad, because if you didn't, I'd be really unhappy with you.
Yeah. And we're going to talk about that too. But what I want to do for a minute is I want to step back and talk about why this story that you're telling us is important for the listeners. Okay. So for me, when I made a vision for my practice, I described exactly who I wanted to treat in my practice. And it was someone who appreciates the care, the excellent care that I give by saying thank you and by showing up to their appointments and by paying their bill happily. And what happened is when I started doing that, I found that some patients who didn't fit that vision kind of self-selected out of the practice. And what I had left over a few years was the nicest collection of people in the state. They're like such wonderful people. In fact, my specialists tell me, Laura, when we get a patient from you, we already know they're going to be nice and grateful, and they're already going to know what's going on because they're invested in their own care. And what's happened is over time, what I've noticed that I really love about being a dentist is doing that nurturing, caring for, spoiling thing. And since I have all these amazing patients, spoiling them becomes basically the butter to my day or the frosting to my day. Like I personally get so much of a zing out of getting a pillow for my patient myself or laying a heated blanket on them. And when I started talking to you about NuCalm, it was in this awareness that I actually really enjoy spoiling my patients. And so what we did was we started offering NuCalm to the patients, and NuCalm's changed over the years, by the way. It used to be a little bit more complicated to integrate. There was a cream and some other stuff that seemed a little complicated to me because I had a friend who did it, but I'm like, I don't want to put cream on people's necks. And it costed more back then. It's gone down in price. And what I find now is that I can take, for example, I have a patient, okay, maybe getting ahead of myself, but I'm excited about this. I had a patient, she was brand new to the practice. And she fully admitted when she first came in that she was really, really nervous. And I was like, it's okay. I got you. Let's do the exam and see what we find. Well, we found like 15 cavities. And I could tell that her brain was having a hard time processing that. And she was definitely ready to say to herself, I can't handle this. I'm running away. I said, listen, we have technology here that will help you relax. It's very easy. It's reversible. We put this little sticker on your wrist, put the headphones on, and I suggest that we use the rest of our appointment time right now to just go ahead and use the technology and do a filling on you right now so that you don't have time to go home and worry about it. And by the time we're done, you'll find out that you're actually going to be okay. And that's exactly what we did. And she was so amazed at how more relaxed she felt, even though she just had learned that she had like 15 cavities. We took out the biggest two, they're right next to each other, 14, 15. And the next time she came back, this is someone who could hardly even sit in the chair. We did every single one of those cavities in one longish session while she just NuCalmed and meditated.
Yeah, it's so powerful. And the stories are the best way to explain how powerful this technology is. And we're dentists, like give us data, right? Like give us, like, what do you mean? And there, so NuCalm is, what NuCalm does is it stops the anxiety stress response and puts you into a relaxed meditative state within minutes with no drugs and no side effects. Now, to a dentist, I'm a dentist. That's too good to be true. Like I don't, and when I first used it at that convention in 2014, I didn't believe, there's always the next best thing. I'm already so overwhelmed by everything.
And
But
don't you always feel like someone's got another piece of equipment to sell us and we have to buy this so that we can keep up the practice, and we need this CAD cam or we need this scanner or we need this
yes,
razor or whatever. And
there's a
so
lot of resistance from the team because the doctor's always bringing, I was anyway, I'm always bringing stuff back from a show, and they're always rolling their eyes like, here we go again, let's give it a couple of weeks, she'll forget about it. And they were usually right, because
sorry. It's just so true. And that just reinforces it for next time.
I
Like,
know I didn't have
okay,
it.
doctor, whatever.
Yeah, okay. Well, the difference with NuCalm is that, well, let's talk about it for a second. So why are patients anxious? Why are we so stressed in the world right now? It's not just about patients. NuCalm is for practitioners and for patients. And when you have a relaxed patient, you as a practitioner can focus on your dental work. You can focus on doing high quality and what you're good at, instead of being a therapist or a psychiatrist and waiting for the patient to go to the bathroom 6 times or salivate or swallow or raise their hand because they need a break. So our physiology is healthier because the patient is relaxed and we don't go home so full of everyone else's emotion and
Yes.
anxiety.
We have to carry that. They're like right here in our face. And we
Very
have to
close.
get them through it so that we can get through our day.
Our physiology is affected negatively by someone who's highly anxious. Our blood pressure goes up. Our heart rate goes up. We all know that's true. And it sucks us dry. It sucked me dry. And I think it's pretty common. So why are patients anxious? So we're asking them to lay back, belly up, throat exposed, mouth open. This is not a safe position, number one. We have millions of years of evolution saying, do not go belly up, throat exposed, mouth open to sharp instruments coming in to your mouth.
That's a very good point.
And we're in fight or flight. They're in fight or flight, literally in survival mode. You know, we've got 40 billion, I think it's 40 billion years actually of evolution of our autonomic nervous system that keeps us. It's why we've survived. So it protects us from all that happens. You know, there's no difference between a real threat and a perceived threat in our minds. It's
exactly in our minds, it's the same.
Yep. So this primal brain is unconscious. It triggers a cacophony of neurotransmitters that shuts down our digestive system, makes our pupils dilate. You can't have a rational conversation with a patient in this state because their frontal cortex is closed down. It's all primal. How many times have you said to a patient what they need or what's next or how to take care of what you just did? And they go, you never told me that. And you told them 3 times and your assistant told them and they told them at the front. And that's why. It's not that they're not listening. They can't. They have no ability, no cognition. They can't process information in that state. So what NuCalm does, it balances the autonomic nervous system. The autonomic nervous system is fight or flight, rest and digest. So parasympathetic, sympathetic. And parasympathetic is the rest.
Yes.
Rest and relax. So what it does is it's a 3-component system. Do you want me to go into this right now? Like the components of it, or
give us like the 30-second version?
The super short version. There's 3 components to NuCalm. And again, this has evolved over the years. This used to be a class 3 regulated, federally regulated medical device. And now it's more effective and more simple and more affordable. So the first component is, it's a little sticker about the size of a quarter, and it goes on your left wrist, 3 fingers below your hand. It goes right about where my bracelet is here. And what it is embedded with the frequencies of GABA, which is the opposite of caffeine. GABA goes into it signals your body to shut down stress and anxiety, and it makes you receptive to the neuroacoustic software of the NuCalm that you hear in the headphones. So the disc shuts down the stress response. That's the simplest way I can put it.
Okay.
The second component is the neuroacoustic software. This is an app on your phone. And there's different tracks, and the different tracks we are pacing your brain into a different frequency, like a NASCAR pace car. We're managing the human brain, not an easy task, not an easy ask. The neuroscience behind this, it took 20 years to invent this. So anyway, what it does is it paces your brain into theta, which is very slow, long brain waves, which is the place where deep meditation is. It's where you can restore your cells, your energy, your healing happens. Patients have less inflammation, less bleeding, because your brain is in that theta state, which is deep sleep.
And Bethany, let me stop you for a second here. So the neuroacoustic software is basically suggesting to your brain that it go ahead and go into this deeper, slower wavelength. Is that correct? It's like, this is where we're going. Go with us.
Well, it's not really a suggestion. They've done so many studies that if you have a nervous system and are alive as a human, This changes your brainwaves. And I think, of course, if you're listening to NuCalm and dancing on the dance floor or something, obviously it's not a drug.
Right.
It's not a drug. So you can resist it, especially if you don't have the disc.
Mm-hmm.
But it's very consistent, reliable, and it's patented, which means it's gone through exhaustive clinical trials. The best neuroscientists in the world, C.K. Pang, who's the world-renowned expert on heart rate variability. If there's ever a heart rate variability study, his name is on it. He tested NuCalm, people 5 minutes before and then on NuCalm and then 5 minutes after. And the physiology is the same. Like they always drop into the same brain pattern at the same time. So,
and I want to add here that I wear a Garmin. So the first couple of times I did NuCalm on myself, because I do it on myself all the time now for these reasons that you're naming. It's really cool because I can even see. One time I put the sticker on and I got interrupted with a phone call, and I was on the phone call for a half an hour, but I looked later and my heart rate went, and it slowed down right as soon as the sticker went on. And then of course it stayed there throughout my NuCalm session. But it's just really cool. I mean, if you need data or evidence, it's so fun to do it on yourself and then see because my Garmin also tells me about stress. If I'm in stress and my body battery, whether it's going up or down, and every time I NuCalm, the stress is 0 and the body battery is going up while I'm doing it. I have no idea how they measure that, but you can get back to your science now.
that's amazing. So I have an Aura ring and it measures HRV at night. And I use NuCalm in the morning as soon as I wake up to start my day with a boost of energy. And every single time my HRV goes up, it improves exactly the time I put my NuCalm on. So yeah, and make sure you're not wearing your Garmin on the same wrist as your disc, because it will erase. The frequencies of the disc are very susceptible to EMFs in the environment. So just a side note.
Yeah, I just move it over.
Yeah, you can put it on
Because
your
I
other
like measuring, I like looking at the data, so I leave it on, but I just move it over.
Yeah, I put it on your right wrist. Yeah, I'm the same way. And I love doing my own research. We love doing that as dentists, right?
We're so nerds. We're nerdy. Yeah, but it's good. But
yeah. Oh my gosh. But
what was it like for you? Oh, go ahead.
No, you go ahead. I was
just going to ask you what it was like for you when you started using NuCalm on your patients.
Well, by the time I was using NuCalm, I was only working part-time and it wasn't my practice, but it's still, so I couldn't like implement it the way I wanted to on every patient. That's what I wanted to do. But what happened was, so this is let me tell you the first patient I used it on. You ever have a morning huddle and you see a patient's name on the schedule and you're just as anxious as they are because this person is so hard to work on, or
they might be hard to numb. Maybe they can't lay back. Maybe they have a tongue that's like a dragon.
Yeah, so they have to go to the bathroom every 5 minutes, or so you schedule like way more time than you would need if they were more relaxed. Anyway, that person was on my schedule. She was coming in for a root canal core crown. Right? Like, I'm like, I'll just get it all over with. And I think it was like number 10 or something. I don't know. So I'm like NuCalm all the way on this person. Yeah. She came in and you don't explain it to the patient. If you tell them that you've got a neuroscience technology, and they're like, no.
Right.
Just tell them this is a relaxation system. It's a great technology here. To put this sticker on your wrist and headphones, great. It's new agey music, nature sounds, some tones, things like that. It's very relaxing. And then some dark glasses or an eye mask. And so she was very open to it. I had it on I left it on her for about 10 minutes before I did anything. This woman had tears in the past. She would cry the whole time. And she wasn't like sobbing, but just tears flowing out of her eyes. And I had to have a towel on my leg because it would drip off the chair onto my leg. So I'd always have my towel when it was extreme.
Yeah.
And, she would gag and she couldn't open her mouth very big. And but she loved us. You know what I mean? Like you always learn, like, why does this patient love us? Because we pamper them, just like you were talking about.
That's what we do. It's
We give
wonderful.
that.
Yeah.
Yeah. So NuCalm, I put the NuCalm on her for 10 minutes. I did her work. I think it took me an hour and a half. And I had her scheduled for, I think 2.5 hours. We took the NuCalm off. She was done. And I said, how do you feel? And she's like, I feel fine. I feel great. Are we done? She's like, that was like 20 minutes, right? And because NuCalm disassociates you from time and space, you feel kind of heavy and you feel like almost you're in a dreamy state. And so when you take it off, they don't know how long they've been on NuCalm. So she was so excited. She's like, oh my God, because usually she's tense and she's sore for 2 days. She was so excited. She never wanted to pay her bill, of course, in the past. She did, but she went out, paid her bill. She probably told the whole town about this NuCalm. I think I got so many new patients because she was telling everybody about it. But it was a great experience. I got to do my work. My stomach wasn't in knots. Instead of like this with purple fingers, you know how patients do?
Clenching on the
just
other or on the arms of the chair.
Just relaxed, not one tear the whole time. And her mouth was, open and
Pliable.
yeah.
Not just so stiff.
So the benefits are not just for the patient. Actually, the benefits are more for us as practitioners.
I agree. I feel like it's great. It's a great service for the patient and I love spoiling them, but we put them on NuCalm for me.
Yes, you and your team, because we're here all day in the chair. They're for 1 hour or 2 or whatever it is, and they go home, but we are constant. And I know that NuCalm would change the way the dental profession is perceived in the world. And it'll change the way we perceive going to work. When more people know about this. This is leading edge. It's lonely on the leading edge. I've been a proponent of NuCalm for years, and I've joined their team now because I'm that passionate about it. I still coach, but I fold it into my coaching. I use NuCalm on my coaching clients too, when they have a particularly rough session, very cathartic, deep, not rough, but deep work.
Yeah.
And the healing is catalyzed, the processing of the emotion and all of that. So
I want to take a minute to describe what a typical NuCalm session is like for me. And I think a lot of it has to do with like what kind of state I'm in when I start. But I've never done a NuCalm session, and typically, you can do it in as quick as 30 minutes or even 20. I like the 40.
Power nap, 20 minutes. Yeah, that's minimum.
Yeah. There's a 41 that I like quite a bit. I like the music in that one. And there's some guitar and some like bubbles, some string music or something.
Yeah, so you can choose. Yeah, you can choose your time. There's different times and different tracks for different things, which is all something that will be explained at some point.
Right. For anyone who wants to hear about it, and I totally recommend. I mean, even if you don't use it on your patients, like get it for yourself. I'm not saying you don't, but
it is a reset for your body.
Yes, what I want to say is I'm a highly productive person. I'm boom, 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 next thing, next thing, next thing. But NuCalm is something that will help me not only relax, but also refocus so that I'm not acting like randomly or flailing and running from this thing or this thing.
Stops the monkey mind.
Yeah, it stops the monkey mind. And so I'll just lay down. I'll be like, this moment is for me. Get the eye mask, get the headphones going, start the app. And then usually what happens is I either kind of just float along or I start having really amazing ideas. I have amazing ideas a lot while I'm NuCalming, and I'm like, I already know it's going to stop when I'm at 40, so I don't have to worry that I'm losing track of time or anything. And then when I take off the eye mask and I'm all done, I usually keep a notebook there and I just write down whatever I was thinking. And I always feel refreshed.
Like I said, a reset button.
Mhm.
And when you're done, like when I'm done, I feel clear, like you said, clear, focused.
Mhm.
People think they don't have 20 or 40 minutes to lay down and use NuCalm, but
Mhm.
the productivity, the efficiency of your mind, your ability to focus on one thing at a time.
It's
I've
almost like you don't not have time. Like you better take the time or you'll be sorry. It's so much better
time.
if you save the time for yourself, reserve it for you, and wake up feeling refreshed and ready to take care of people or take care of yourself, whatever needs to be done.
Mm-hmm. And you never not wake up, come out of, you're never unable to respond. You're always able to, if someone comes in and talks to you, you can, and patients too, you can talk to them and tell them to turn their head or ask them how they're doing. And they're like, I'm good. They will still respond. It's just their brainwaves are slower. So their body is relaxed. So I've never come out of a NuCalm session with monkey mind. It's always like, okay, like chunk. Now, what's most important? Here I go, do this, do that. And it's 20 minutes on NuCalm is like 2 hours of deep sleep to your body, restorative sleep. It's not a replacement for sleep. You still have to sleep. People are like, whoa, I could do an hour in NuCalm. And that's like 6 hours of sleep, but it's not a replacement.
Well, but speaking of sleep, this is a good story. I have a patient, I mean, an assistant, because when we bought the NuCalm, everybody tried it. Okay. So the team knows how nice it is to do NuCalm.
And that's why they're on board to use it, because
that's right.
They tried it.
Yeah. And this particular assistant has a new baby at home, and her fence in her backyard was destroyed by the big giant storm that our city had last summer called a derecho. Decimated our city. We lost over half of our trees, and she had this privacy fence. And this is important because it holds in the dog and holds out the neighbor's animals and stuff. The neighbor has chickens. Well, over in the middle of the night, the husband went to let the dog in. And at the same time that the dog was coming in, a skunk was spraying it. And so the spray came into the house with the dog. The dog had zoomies. The baby wakes up. My assistant wakes up from the smell of the skunk. She doesn't, it's in the house now. She gets to work 8 o'clock in the morning and her eyes are puffy. She was super tired. And I usually run 2 columns at a time. One column was open. She said, can I just lay down in NuCalm? And she did. She stayed there for like 2 hours, just NuCalming and restoring so that she could do the rest of her day, because she hadn't even gotten back to sleep since
wow. She probably smelled like a skunk too.
She didn't.
Wow, that's amazing.
I know.
So she felt better. Was she able to assist all day? And
yeah, yep. She picked right back up and did her normal thing. So I'm sure she slept very well that night. I'm not saying it replaced the sleep, but that's what she wanted to do with her time when we realized we didn't need her.
Yeah, there are cumulative benefits to NuCalm, and that's one of them too, is that it balances your circadian rhythms. You will sleep better. If you use NuCalm once, you'll sleep better that night. But over time, it balances your sleep, your hormones, because your body has a chance to turn off the stress. Right now in our world, we really just redline with our technology, the news. When's the last time you watched the news and then had a feeling of peace and calm?
Never. I try not to look at the news.
Me too. Like if I ever watch it, it's very, rarely, because it really makes me, nothing makes me anything. I feel bad after I watch the news, but NuCalm gives your body a chance to take its foot off the accelerator of stress. We've got technology. Our food sources now aren't like they were 20, 30 years ago. So, it's more acidic. Our bodies are, a lot of times we don't even eat food. What are we eating? These
Just
processed,
factory stuff. Yeah.
these things, and our bodies are acidic and inflamed, and we're trying to push through stress. And NuCalm says, whoa, give yourself a break.
Yeah.
And the reason I'm so passionate is because dentistry is stressful enough without a pandemic, without all the new technology that we can't keep, just constant on the phone and interruptions. And aren't patients more on edge now than they used to be?
Oh, for sure. And you should see them after the pandemic. Like they're a little downtrodden and they've
Yeah,
been clenching and they feel like their sleep apnea has gotten worse. And
a lot
some
more
of them,
bone
their
marks.
mouths just blow up with cavities. It's been a stressful time and we're definitely seeing it in their mouths too.
Yeah. So NuCalm is a respite. It is, for me, I've used it every single day since the pandemic began. Before that, I was using it. I went a few months without using it. I might have gone a year, which was ridiculous. Like I have this secret weapon at my fingertips for stress. And I kind of because like you said, it was more complex. You had to do the cream and there are these stimulation pads behind your ears. And now it's so much easier.
It's
But
so easy.
I haven't skipped a day in almost a year and a half. I use it every day, even for 20 minutes. And in general, I'm an anxious person. I'm like high strung. That's how I've gotten through life. Push, 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 type A personality. And I'm still that way. I'm still very focused and, but I don't have that acidic stomach that, I don't know. I don't know where I would be without NuCalm right now. So that's why I'm so passionate about the dental profession. It's my desire to make life easier for dentists, because what we do in the dental profession is so honorable. This is an honorable profession and we are so heartful. We make mistakes. Everyone makes mistakes, but I believe that every dentist is really giving the best they can and doing the best they can in any moment. And this is going to help.
Well, let me ask you a question. So, I've got listeners here. Maybe some of them are saying to themselves, I need this. I need this for me. I need it for my practice. What's a good next step for them to learn more or just discover, what it would look like for them?
You know what? I meant to give you, there's a link to a YouTube video of the CEO talking about dentistry and NuCalm. It's the best. It's so good. He goes into more detail about it and the research, and he's really interesting. I'll give you that link. Maybe you
put
can
it in the show notes.
And you can always contact me. I am so happy to have conversations. I have a Calendly link that you can make an appointment and speak with me. And there's also a link to the website that's for NuCalm for dentists specifically. So I'll give you that link too.
Okay. So in short, then ladies, if you're listening to this, go to my website, loveyourpractice.net, and get on to the podcast section of my website and find this. This episode should be the 51st, I think, episode. And you can find those links in the show notes.
Yeah. NuCalm isn't new in dentistry either. We actually got 5 stars in Dental Product Shopper. Have you seen Dental Product Shopper? They rate all kinds of products for dentistry. And it's the only product that's ever gotten 5 stars.
So, oh, really? Oh,
yeah.
Well, there you go. Ladies, now you have to click on one of those links. Just
now you have to go because
5 stars.
Product Shopper
said it. 5 stars. Dental Product Shopper says it. Well, you probably have to go get back to your horses or something, huh? You don't have unlimited amounts of time today. But I just want to thank you so much for taking the time to explain that. And thank you for not introducing me, but bringing me along on my little NuCalm journey so that I could be enjoying it, both in my practice and in my personal life.
I'm glad you had heard about it before, because sometimes it takes a while. Like I heard about it, and a few years later is when I tried it in 2014.
Yeah.
And, it's one of those things that's a process. So
yeah, Absolutely, like anything else. So thank you so much
Thank
and
you.
enjoy the rest of your day. And
Thank you for listening to Love Your Practice with Dr. Laura Mock. I would love to meet you. To join our movement, find the Facebook group called Love Your Practice and request to join. If you can't find it, just send me a message and I'll add ya. You'll find me there helping all of my ladies to fall in love with their businesses and have a better life.